Good afternoon, everyone. My name is Jeff McKay with Brightsquid. I'm going to be introducing the webinar today. Thanks for tuning in to COVID-19 privacy considerations for reopening. With me today is Rohit Joshi, co-founder and CEO of Brightsquid. Rohit is a lawyer who brings a lot of insight into the legal implications of privacy, as well as Ingrid Rice, who is a privacy expert who also knows a great deal about compliance. And has worked with thousands of clinics across Alberta and North America to make sure that they're compliant. As we reopen, there's obviously a number of considerations with the precautions that are being implemented, different protocols that clinics are doing to keep everybody safe. And all of those have a number of different privacy considerations. So there are actually changes to the, your privacy structure, your policies, your procedures, your security, because there's a lot of new information that's going to be coming in and out of your clinic and different procedures. So we're going to talk a lot about that today. First, we're going to talk about employer obligations. So what's the baseline? What do you have to do as a clinic, as an employer for your staff? What are some of the additional safety measures? What are the considerations for patients and staff that you need to look at? And then, things about who and how to notify people. Let's say somebody who came through your clinic is later diagnosed with COVID-19, what sort of things you have to do then. And we'll talk a little bit about virtual care. We've got a lot more stuff about virtual care, so we're not going to spend a lot of time on that. So let's dig in, and I'll hand things over to Ingrid and Rohit to talk about employer obligations and where we go from there.
Thanks, Jeff. I think that's the fastest I've ever heard you do our introductions, which I think is indicative of the fact that we've got a lot to cover today. Reminding everyone that they can feel free to ask questions afterwards, because I think we're trying to get through a bunch of content that's particularly relevant. So, I think where we start with is, from an obligations perspective, what's changed in people's roles, what's changed in the clinics that you're operating. And the first thing is, there's an obligation to make sure that the workers have skills and training needed to do their jobs. And so the things that have changed is clearly the environment and the safe workplace. So how do we ensure that all workers are aware of the health and safety hazards at the job site? And again, this is something that's changed dramatically with COVID, because we now all have new policies, new procedures that are going to have to be used in order to ensure that workplace remains safe. Establishing the safe work practices and ensuring that those practices are followed it's a shared responsibility between the employer providing guidance and all of the employees managing themselves. But in order to ensure that we're all on the same page with respect to the type of changes in the workplace, there absolutely needs to be some policies, and I'll turn it over to Ingrid to kind of talk about that. As a part of that policy, providing safety equipment and training, and especially in clinics here, we have to make sure that we're doing the right things to protect your staff and your patients. And part of that might be something as simple as a safety equipment, of course, the personal protective equipment that's available, but also making sure that people are trained so that they know exactly how to use it, how to be effective. Because if you provide the equipment without the training, there's a big loophole there, just in the usage of that product. And ultimately, the clinics do have the ethical and professional obligation to protect the privacy of all of the patients in their care. And I know that, I'll put it this way, I think there was some straying, and it was endorsed by many medical organizations and dental organizations. There was some straying from strict privacy obligations that were required in order to make sure that we serve the patients well. But and I'll turn it over to you, Ingrid. I love your comments on this slide, and basically what I will say is a reaffirmation, if nothing else, of the privacy requirements in terms of the patient's needs.
Well, and that's just it. I mean, the privacy requirements haven't changed, whether it's a pandemic or not. But you now have to think you've got additional information you're collecting if you're starting to come back and taking temperatures. I mean, where is your obligation now? Do you have a policy? Do your staff know what to do? Do they understand it? And all of that we're going to discuss further in the slides, but there are a lot of considerations that come into it. And what your obligation is as an employer is actually not much more rigid than it was before, but it definitely does not negate the privacy that happened.
Yeah, I think what we're realizing is, you know, any office scenario, any scenario where there are individuals that are going to be in any level of contact with one another, there has to be a clear and defined signage, there has to be clear and defined policies, there has to be a level of clarity there, the guidance of which is a challenge, right? I mean, even for our organization, looking for good guidance on how you know, what signs do I need, and it's changing, and so that's something that I think we can help with. There's also lots and lots of other materials based on your local province or state, guidance from the health authority to say, here's the type of posters you have, and I have seen, because we were looking for them ourselves, there have been lots of opportunity to actually download those things that have already been created. Jeff, let's jump to the next slide.
So additional safety measures, for example, you know, what is reasonable for maintaining the safety of your patients and staff? Is a sign enough? Is, you know, a questionnaire enough? So when somebody comes to the door, they're greeted with a stop, do not enter. But is there questions that you ask when they come in? So there are some easy safety measures that can be taken, but also you need to keep in mind that we need to protect everyone and comply with the privacy regulations. They do not go away, notwithstanding the fact that we're ending a pandemic, or hopefully ending a pandemic.
Yeah, and I think that, you know, one of the things that has kind of taken over is this idea of taking a temperature. And so let's say that is a safety measure that you have decided to go with in your clinic. The reality is first of all, there needs to be a policy first of all, there has to be training of the person taking the temperature to make sure that they know exactly how to do it properly. The second element is, what is the process if that temperature is normal versus what is the process if that temperature is abnormal, and is that policy written? Because I think that people sort of expect that that your staff who is taking the temperature will know what to do, and in many cases that's not there, and it actually should be defined so there's not a sense of someone feeling discriminated, you know, against, in the sense that your patients should know what the story is, your staff should know what the story is, and then you have to execute in a consistent and in a consistent manner to ensure that there's no level of working around the rules.
Yeah, and if your staff have a policy in place and know the process, it makes it a lot easier. And it also gives them a sense of security that you're on it, you know what you're doing. So an example is exactly that. If you have a temperature check that is abnormal, what is the process? That needs to be clearly defined, and we'll discuss that in the next slide, I believe.
Yeah, and one of the things that we talk about here is checklists, right?
Always, yeah.
And so it's important to understand as a checklist when someone comes in through the door, whether it be staff or if it's a patient, what is the series of actions that need to occur, and how do you document those? And I think that we're going to get to some of that now. Next slide.
So an example would be if you are charting, or if you are keeping that information, what do you have to do with it? So you have to have these, first of all, you need to consider the patient. That's uppermost. So what measures does the custodian need to put in place to protect these patients? As well, how can you screen their patients? Are there expectations like temperature checks, screening questions? Do the patients coming in even realize that this is about to happen? Have you advertised? Have you sent out a questionnaire ahead of time? All considerations to look at for patients. So, you know, what are you doing to make your patients aware of this change? Are you setting up a notice in your clinic? Are you sending it through secure mail saying you will be asked the following questions, but for heaven's sakes, if you have a fever, do not come in? You know, just simple things like that, so that the patient doesn't get to the door and realize that they can't come in.
Yeah, and I think we're going to take a little more time on this slide because I think this is where the rubber meets the road in a lot of ways. All right. So let's step through this and make sure that we've covered this as well as we can in the short time that we have. So as a custodian or as a clinic owner, as the custodian in the clinic, you want to ensure that no one obviously gets sick by coming into your clinic. And so that's where the basis of having a properly safe environment for your patients comes in. That, of course, means that your staff have already been trained and planning for this. I really like the idea of making patients aware well before they've ever come to your clinic. Now, I would say the level of awareness from the practices that we're talking to, the level of awareness has gone up. Patients do know more than they used to, but you have to make it clear with the operation of your clinic. And so there are ways of broadcasting that information to your patients. One of them, of course, is secure mail. Our product, you may want to put a notice up on your website so that patients that are trying to book appointments, you certainly want to tell your staff when they're calling their patients in to recall or giving them an appointment reminder, let them know of the procedures so that there's a verbal as well as a written policy discussion about what patients need to do before they come to your front doors.
Yeah, and this can be done positively. For example, you can say, these are the steps that we have taken to protect your health. These are the infection control procedures that we have done. Here are the steps that we've taken. It does not need to be you will, you must. It is much more positive, saying that we're demonstrating our healthy behaviors and we are passing this on to you so that you're aware of what to expect when you come into our clean clinic.
Exactly, and I think and I've seen lots of businesses started to take that approach, including businesses as diverse as restaurants, where they're saying, here are the measures that we are taking, feel free and comfortable to come in. And I think that's an important consideration in trying to work through this.
Well, and as well as you have to consider, are you going to supply masks if a patient doesn't have it?
Yeah.
And this is just for an area such as the waiting room. Or are you going to request that they wait out in the car and you will call them when it's their turn for appointment to minimize the amount of people in your waiting room? Yeah. Just considerations for good practices.
Yeah, and I think both of those have been successful strategies in the clinics that we've spoken to. Full parking lots is not a bad thing.
No, they're physically distant.
They're physically distant.
And then, of course, what if a temperature, somebody comes in with a high temperature?
Yeah.
Do you send them away at the door? Have you just now exposed your staff? Do you shut down? Yeah. So you have to be prepared and have these policies so that or a checklist so that your staff know what to do if indeed that happens.
From a patient privacy perspective, we want to make sure that if you have a checklist that you're going through and ticking off a process, I would recommend that every patient that comes in, that you have a separate checklist, because then that forms part of their record. Because let's take a scenario. One scenario might be that a patient comes in to your clinic, they've checked the boxes, their temperature is normal, and have passed the let's get into that clinic. Well, in fact, they may be asymptomatic and find out a week later.
2 days later.
2 days later that they actually have that high temperature. Well, as part of contact tracing, they're going to want to be able to inform you that they may have been in a position to infect others when they came to your clinic, even though they were asymptomatic. For the protection of the clinic, you need to have that record to say, well, when they came here, we did do our diligence, we did do our due diligence, and in fact, they had a normal temperature. That doesn't stop you from having to make the next step, which is who do you inform. But at least from your staff and from everyone else's perspective, you have done the right steps and you've documented that within their patient record.
Yeah.
Next slide. So let's talk about the staff. And this is where, it becomes an interesting challenge because, first of all, your primary obligation to the workplace is making sure that they are safe. And extra training in processes for infection control really start with, the process that you're going to document. because as new people come in, including temporary workers that you may be using in your clinic, including the IT staff that comes in, including, so that's actually something that is a much broader policy consideration. And because your staff have to basically be continue to do these processes for whoever's coming into the clinic, it's important that that policy be very, very clear. So for starters, I would say that we need that policy to be in place, and in fact, the training to occur, because as we've seen way too many times, 2 or 3 people write the policy and then no one adheres to it because frankly, they may not know. At that point, then we have to say, all right, so if the custodian has made this decision that they are going to be taking the temperature, what impact is that on the employee, and can they say no? And how do they say no? And what do you do if they say no? How, and maybe this next question about staff being aware of the new policies, for sure they have to be. So in our experience, the right way to do that is through a Zoom call, if you're using that type of media or communication method, or an in-person meeting, definitely a written notice with some degree of auditability that says that someone has been trained in how to be safe. Employment and confidentiality agreements is a great question. I'm going to leave that hard question to Ingrid. And then, what's the duty of care that's now changed with COVID?
But it's the same thing. Are you going to be having a checklist for your staff? When they come in, they have the same obligation to answer those questions, because you need to make sure your staff are healthy and safe as well. Will you be doing a temperature check? Most likely, if that is. And your employee says, well, really, you didn't tell me about that, or why do I need that every day? I'm healthy. This is just a protection and a risk liability reduction, really. So you need all that, but you do need to make your staff aware that we're going to do this for this period of time, no matter what. Things like, are they going to have protective screens? Are they going to have just these minor things that seem maybe minor to us, but you see that all over. They're dealing with the public. Do they have a protection screen? What have you done to help protect your employees as well?
And I think that goes to the duty of care, right? Like as the clinic owner or as the custodian of the clinic, I think it's increased the duty of care and reasonably. And so what that does is it starts to create the logic of, we have upped our standards for the clinic care, and what does that mean in terms of the safety of that employee? And I think that has changed, and it leads me to actually very specifically talk about medically vulnerable employees. And Ingrid, I know that we've thought about that before. Maybe we can lean into that now.
So what would you do if you have someone that has an immune compromised system, or if you have somebody that has children that have that? I mean, you have to also be aware that the staff have a right of refusal from a point of view that you can't expect somebody with a compromised immune system to be sitting at the front desk greeting people that may be infected. So you have to look at those considerations too.
Yeah, and I think when it comes down to being very practical about this, for starters, being very practical again, if you have a patient that is medically vulnerable or has a family member that is, let's start with the fact that we want to see if they are able to continue to work from home. Now, I know in many clinics that's not possible, but maybe there is. Maybe there is the opportunity for them to continue to work from home. And that really, we want to say that we believe that should be the first option. And that's certainly what the approach that we've taken for our employees. The second is that we want to make sure that there's a good process to field those questions and concerns. And again, so that it's not an individually based decision or discussion, because you may find that if someone has to be in the office and they are medically vulnerable, that you may have to make a staff or position change. And that's just the reality of what we're dealing with. That's the subject of maybe another discussion, but I think that decision has to be clear and unprejudiced. in the sense that there has to be a policy that you've created, that you've communicated to your staff, and that doesn't put them in a position now where they are compromising their own safety by having to show up.
Well, and they need the reassurances that they're not going to get fired if your temperature is high, or that if they say, you know, I'm medically compromised, I can't come in, and well, you're fired. But if you have this policy and procedure written out, then of course they've got that reassurance that, okay, these are the steps I need to take, and these are the options that are open to me.
Yeah, this is a big one. Let's, again, in the interest of time, let's jump to the next slide.
So in the end, who do you notify? So if somebody comes into the clinic and has COVID-19, indicates they've tested positive recently, comes in with a high fever, and later announces that they've tested positive, you have an obligation to report that to Alberta Health Services in the case of Alberta, but with any provincial or federal or United States organization, you need to report. It's a report you must do. And then there's contact tracing, of course. But more importantly, do you have a list of all the people affected? So all the people that were in your clinic that day, for example, do you have that list? Now that comes back to that policies and procedures. If you have a checklist for each patient, then you've got that information all recorded and in one spot, and you can easily pull out, yeah, June 30th, here's the information for that date. And then the contact tracing begins and all the phone calls begin, but you have to keep that in mind.
You do, and you know, there is, of course, the most clinics that we're connected to would have a day sheet and they would know who's coming in. But just, you know, people miss appointments, some people do show up, don't show up, and making sure that you validated that you have the right way to contact them. Because nothing's going to be worse than them coming in, an incident occurring, and now you can't get a hold of that individual. There's a level of diligence that's required.
Yeah, and it's also for your own health and safety, right? So that you know, okay, this has happened, we did not have that patient come in that day. Or, you know, you find out on the news or you find out that your area is a hot spot, you at least then have all the information at your hand. If you keep it, and that's where that, again, that checklist and that keep a record and keep track, and then destroy it during the retention period when it's expired.
Yeah, it isn't going to be relevant forever.
Correct.
So
I hope not.
it's the type of data that is only relevant for a reasonably short period relative to the other data that's available. One of the important elements here that we should talk about, I think it goes without saying, just knowing what the obligations are, but in notifying individuals, I would consider this highly confidential information. And even though it's reasonably, it's becoming more common every day, ensuring that the confidentiality of that patient or that clinic staff who's tested positive, that becomes paramount, because there's absolutely a change that may occur to their family life, work life, friend life, whatever that is, if that data gets out. And of course, the people that need to know, you need to notify, but disclosing who the individual was on what circumstances is absolutely not required and not something that you need to do.
Correct, and that's critical, right? That is still personal information, their information. It is no one else's business. It's merely a person tested positive, not even male, female, no other identifiers.
Agreed. Next slide. Yeah, and so this is a virtual care. I know that we've done, Ingrid, you and I have done a number of webinars and had a number of discussions about this over the past little while. And I think where you and I have ended up, and the guidance that we're giving is, don't do anything new that the technology allows you to do if you wouldn't have done it in your practice anyways. Let's start with that.
Right, so a virtual visit, the way I always identify it, is exactly as a clinical visit. You don't change anything. You don't certainly record your clinical visits. So don't start by recording your virtual visits. Just as a simple one, your policies need to be updated to reflect that, as well as how you're securing that the lines coming in and out and how you're ensuring it's the correct patient. Those information need to be in your privacy policies and updated. And it also is just a simple matter. Are you videotaping the front entrance of your clinic when you're doing your COVID testing now? You need to update that information and at a minimum understand and have your staff understand that these policies are in place, that recording will be destroyed after 1 day, That all needs to be explained. It isn't just one and done anymore.
Yeah, and I would say that, some of the clinics that we've been working with do have a little bit of a disclaimer whenever they're having a discussion, because it's not just the fact that you're not recording. It's important to disclose the fact that you're not recording, because there is a level of transparency that changes because you're no longer in the same room with that individual. So going through a small bit of disclosure here, just from a transparency perspective, letting people know what's happening with that information, who's going to receive the information, how it's being recorded, all of that stuff can be done in 1 minute or 2 minutes and is well worth it. Just again, from a transparency and ease perspective. I will say that we saw a lot of
uptake.
A lot of uptake of virtual care. The challenge was that in many cases they were using technologies that were not authorized or sanctioned by the medical associations from a privacy perspective. Don't use FaceTime as an example. Yeah. Don't use those technologies that are convenient, but don't pass the medical rigor of privacy, because you are setting yourself up for a world of hurt when and if that breach occurs. I would just really encourage you to use systems that have been vetted for their privacy and security, or else you're opening yourself up to a level of liability that you really ought not to be.
Yeah, and as we've said before, the rules, the Health Information Act, all of the guidelines for privacy have not changed. They have maybe, if anything, they've allowed a bit of leniency in the filing, but it has not changed. You still need to notify the commissioner you've changed something, or you're doing virtual care at this point. And don't forget that a critical part is your information manager agreements, to make sure that you have your vendor as compliant as you are.
I think we're almost out of time here, Jeff. Why don't we just jump to the last or the next slide?
I'm just going to
go ahead.
I'll just go through these quickly because we do have a couple questions I want to get to. Additional resources, just because this is changing all the time. You can, if we haven't done your privacy for you yet, you can do a quick privacy risk or breach risk assessment. Get a sense of what your risks are. It's a couple questions. You can go to our website, find a section with this title here, learn how your clinic is at risk. You can sign up for virtual care webinars on a weekly basis. We run them every Friday at noon Mountain Time. Just go to our website here, and you'll be able to find one of the previous recordings and sign up there. I'll quickly go through our winners of the draw. Winner number 1 is Irene P. Winner number 2 is Julie T. And winner number 3 is Kathleen for showing up. So congrats to our winners. And we have a couple questions I want to get to really quickly. First, can you request staff be tested for COVID-19?
Yes.
Absolutely.
It is an expectation. It's just out of sheer courtesy, if nothing else, inform them, explain what you're doing with the information, that, it's not at risk, and this is just a course during the pandemic or during a period of 6 weeks post-pandemic for the following reasons.
Let's put a period of time in place for this policy, and then it cannot be applied in a discriminatory way. And what I mean by that is it has to be applied equally, including the clinic owner or the custodian. This is something that everybody in this clinic has agreed to. Make it transparent, get it out there, and then hold everybody to it.
Yep. And then what about tracking people? Yeah, exactly. And what about tracking people in and out of the clinic? What do you do about storing those lists? I mean, I would say you would likely you need to know everybody that's been in and out your doors, right? How do you keep track of that information? What privacy measures should be instituted around that?
Go ahead. There's so many things I want to say.
Me too. So listen, I think we absolutely must keep track of everybody, including, and here's the thing where things go sideways, including the FedEx worker, including the IT staff that's coming. You must keep track of that. So it's not just about patients and staff. It's about everyone coming into that clinic. and making sure that they have gone through the same processes. Because if something goes awry, you want to be in the position to be able to very quickly answer those questions. Go ahead, Ingrid. I think you've got 5 seconds.
It's clinical best interest. It is also just short of being mandated for, that's what you need to do. And that is because there's no way we're going to control and contain if we don't monitor and keep, and that doesn't mean to the nth degree. That means keep the information high level and what you need to know, and keep it for a period of time as determined by either the clinic, or you can pretty well be rest assured that 1 year you can destroy all that information.
Yeah. Thanks, everybody.
I have one quick question I want to shoot. It's a yes or no. Do these changes require amendments to your PIA?
They should, but it's a mere, it is basically an amendment or a letter at a minimum, but they need to know that you have implemented changes, correct?
Perfect. Great. Well, that brings us to end. Thanks, Rohit and Ingrid. Thanks, everyone, for tuning in, and we'll get to any other questions we didn't address directly to people after.
Thank you.